Hello, welcome to Current Study IQ. So, today we'll be talking about Chapter 2 of Class 12 Psychology book, and Chapter 2 of Class 12 Psychology book is Self and Personality. So, we have done about, we have done Chapter 1 earlier. Now, we'll be talking about Chapter 2, which is Self and Personality. So, in this video, we'll be talking about a lot of important questions also. So, sit with your pen and pencils, just mark the important part. And we'll be mostly talking about the important stuff only. I'll not be going through with the whole chapter. Though I'll be going through with the whole chapter, but we'll focus more on the important questions which do appear in examinations and so on. So, our first topic of this chapter is personality and self and personality. So, what exactly do you understand by self and personality? So, self and personality refers to the ways in which we define our existence. They also refer to the ways in which our experience are organized and show up in our behavior. So that is yourself and personality. Now, like personalities are reflected in diverse behavior of persons. So we'll be talking about all these small things. Then we have here is concept of self, like how well do you understand your own, like the concept of self, the notion behind this uh, what is self, what is personality. So we'll be dealing with all these small things in this chapter, starting with uh, the first is your personal identity. So, what actually is personal identity? So, here is the definition. Personal identity refers to those attributes of person that make him or her different from others. That is your personal identity. When a person describes himself or herself by telling his or her name, or your qualities, or your characteristics, your potential, your capabilities, your beliefs, so that is your personal identity. When you're talking about yourself, what you are and how do you explain about your own self, that is your personal identity. Then there is another term which is social identity. So this refers to those aspects of a person that link him or her to a social or cultural group or derived from it, like driving yourself, like are you a Hindu or you're Muslim, Brahmin or Adivasi. So these are your social identity, like basically you're relating yourself to a specific community. That is your social identity. Then we have, so self refers to the totality of an individual's conscious experience, ideas, thoughts, and feelings with regard to herself or himself. So, these experiences and ideas define the existence of an individual both at a personal level and at a social level. That is your concept of self identity and your concept of social identity. Now they are like self as a subject or object. So they like self can be defined either as a subject or an object. Like you can say, so as a subject you can be like, okay, I'm an actor. Or as an object, like I'm an actor and I work day and night, and that is why my whole sleep cycle is being disturbed. So those are the consequences. So consequences are your object. Then we have kinds of self. So here we'll be talking about what are the kinds of self, like your personal self or your social self, your familial or your relational self. So these are the kinds of self. You have different roles at different situation. So when we talk about personal self, so that leads to an orientation in which one feels primarily concerned with oneself. So that is your personal self. Now when we are talking about social self, so that emerges in relation with others and emphasizes such aspects of life as cooperation, unity, affiliation, sacrifice, and support. So that is your social self. This self values family and social relationship, and so on. Hence, it is also referred as your relational self. Understood? Yeah. Now we have cognitive and behavioral aspects of self. So, what are the cognitive and behavioral aspects of self? So, the way we perceive ourselves and the ideas we hold about our competencies and attributes is called self concept. This is your definition for self concept. There can be a question, what is self concept? So, here you go. Then we have self-esteem. What is called self-esteem. So as person, we always make some judgment about our own values or our worth. This value judgment of a person about himself or herself is called self-esteem. Some people are high on self-esteem, whereas others may have low self-esteem. So in order to assess your self-esteem, we present a variety of statement about a person, or we talk about ourselves, like I'm good at homework, or I've always been chosen as a monitor of the class. So these are the things which raise your self-esteem, like they boost up your confidence, talking about your confidence all. So that is your self-esteem. So, if we are talking about in terms of students, then studies indicate that the age of 6 and 7 years children in those duration they form their self-esteem, and they're based on their academic competencies, their social competencies, their physical and athletic competencies, and their physical appearances. So these are the basic domains where usually kids form their self-esteem. See, it's here. Self-esteem in 4 areas: the academic competencies, social competencies, physical athletic competencies, physical appearance, which become more refined with the age. Like you grow up and you kind of filter all these things all along. So but the main formation of your confidence are based on these particular fields. Then we have another topic, which is self-efficacy. Now, what is self-efficacy? So, we did learn about Bandura, where there was this Bobodol experiment in our 11th psychology book. So, but let's see what's here. So, self efficacy is a person who believes that he or she has the ability or behavior required by particular situation demonstrate high self-efficacy. This is what they have said here. Now, Bandura's social learning theory does support this self-efficacy concept. What it says is initial studies showed that children and adults learn behavior by observing, imitating others. So, people's expectations of mastery and achievement and their convictions about their own effectiveness also determine the type of behavior in which one would engage in. So, that is like the formation of self efficacy. So, self efficacy is a strong sense of self efficacy allow people to select, like you can select your friends, you can influence your friends, and even you can construct the circumstances of your own life. So that is your strong sense of self efficacy, and these people feel less fearful also. So self efficacy can be developed. People with high self efficacy have found to be like stop smoking. Like if people who are self with like who are high on self-efficacy. It's like they have said ki they'll not smoke, then they're so true, like they're so much regular with their statement that they'll obey to that statement and they'll quit smoking. So there have been case studies, there have been a lot of research on it where self efficacy has result in quit, like people with high self efficacy are easily quitting their addiction because they're high on self efficacy. Then we I have another like another topic after this, which is um, okay, which is self regulation. So self regulation refers to our ability to organize and monitor our own behavior. So understood. So that is your self regulation. Like you have the ability to monitor your own behavior. This can be talked like in terms of your willpower. And we have another which is self control. So self control plays a key role in fulfillment of long term goals. So Indian culture, you have seen that these vrat, rosa, and all these things. So these are your. This is a way of mastering your self control, where you are being like in rosas. You're not supposed to eat for the whole day. Not even you're supposed to consume water. So that is how like you practice self control, you delay your gratification. So delay, here it is, we often decide to delay or defer the satisfaction of certain needs. Learning to delay or defer the gratification of needs is called self control. Self control is where you learn to delay your gratification of your needs. That is self control, like how much higher you are on your self control. Then there are a lot of like people practice self control through a lot of techniques, like a lot of psychological techniques are being observed. So first one is observation of your own behavior, where you observe your own behavior and you see where you need to stop and what all things you need to eliminate and what all things you need to include. So that is observation of your own behavior. Then we have self instruction. So this is another important technique. We often instruct ourselves to do something and behave the way we want, and behave the way like we want to. Then we have for the effective self regulation. Then the next one is self reinforcement. That is like the third technique, which is rewarding your behavior. If you have eliminated one of your not so wanted behavior and you want to get rid of that behavior and you are trying to eliminate that behavior, so if you have successfully done that for like 20, 10 days, 5 days, or 2 days, then you happen to reward yourself. And like we have studied in class 11th that how the reward reinforcement take place in moderating our behavior. So later to this we have cultural and self. So how does the cultural influence the concept of self? Now so in this whole passage we are discussing about this particular thing, which is your Western perspective and your Indian perspective. So in Western perspective, individual and group are two different things. Like in this is individual and group. You as an individual, your identity, yourself is there, and there's a group of other people, which can be your society, your family, and etc. and so on. So these are like individual is affected with the group, like vice versa. But in Indian perspective, individual is formed with the formation of a group and the society along with it. Getting my point? Just read the passage, you will understand it with more clarity what exactly individual perspective and what exactly Indian Western perspective and Indian perspective are like they're contributing in formation of your personality and the formation of yourself. So now we have concept of personality. So personality is a Latin person. The word personality was derived from a word persona, which is an Latin word which meant the mask used by actors in Roman theater for changing their facial makeup. So, in psychological terms, personality refers to our characteristic ways of responding to individuals and situations. So that is personality. Then here they're talking about the various environmental circumstances which helps you in the formation of personality and so on. So just read from here on. This is more specifically about the personality and what are the terms used in the formation of personality and so on, because now we are going to jump from major approaches of the study of personality. So in this we'll be talking about the trait approaches and type approaches. Here, type approaches, then we have trait approaches which focuses on the specific psychological attributes along which individuals tend to differ in consistent and stable way. Then we have interactional approaches holds that situational characteristics play an important role in determining our behavior. So that is your interactional approach. So let's start with type approach first. Type approach. So the Greek physician Hippocrates had proposed a typology of personality based on fluid or humor. So he classified it into four types: sanguine, phlegmatic, melancholic, and choleric. Each is characterized by specific features. So in India also, Charak Samhita, a famous treatise of Ayurveda, classifies people into categories as Vat, Pith, and Kapha on the basis of three humoral elements called Tridosha. Each refers to the type of temperament, prakriti, like basic nature of a person. Apart from this, there is also a typology of personality based on trigunas, which is sattva, rajas and tamas. Sattva gun includes attributes like cleanliness, truthfulness, dutifulness, detachment, discipline, and whereas Rajas gun includes intensive activity, desire for sense gratification, dissatisfaction, envy, or other materialistic mentality. Then we have tamas gun characterized anger, arrogance, depression, laziness, feeling of helplessness, and etc. So these all three gunas are present in each and every person in different degree. So the dominance of one or the other gun may lead to a particular type of behavior. So this was basically how they classified personality on the type of all these things. Now we have, yeah, so we have Sheldon. So Sheldon classified personality on the basis of body build and temperament as the main basis. So Sheldon is important. So Sheldon proposed the endomorphic, mesomorphic, and ectomorphic typology. So the endomorphs are fat, soft, and round. By temperament, they are relaxed and sociable. The mesomorphs have strong muscular musculature are rectangular with strong body fluid. They are energetic and courageous. The ectomorphs are thin, long, fragile, body build, and brainy, artistic, and introverts. So basically, if we'll say that, like, endomorphs can be the sumo wrestlers, mesomorphs can be the football players, basically. Then ectomorphs can be the basketball players, if we are relating it to the sports. Then comes Jung. So, Jung proposed another important typology, grouping people into introverts and extroverts. So, according to this typology, introverts are people who prefer to be alone, tend to avoid others, withdraw themselves in the face of emotional conflicts, and are shy. Whereas extroverts are outgoing and the sociable people drawn to occupations that allow dealing directions with people and react to stress by trying to lose themselves among people and social activities. Then another we have Freudman and Roseman. So they classified individuals into type A and type B personality. So type A personality seems to possess high motivation, lack patience, feel short of time, and a great hurry always. So type A personality are more susceptible to problems like hypertension, coronary heart disease, risk of developing CHT with type A personality is sometimes even greater than the risk caused by high blood pressure. So, opposite to this is type B personality, which can be understood as the absence of type A traits. So, this further was explained by Morris, which, like, he suggested that type C personality, which is prone to cancer, individuals characterized by personality are cooperative, unassertive, and patient. Then another add-on was done to it, which was type D personality. So they type D personality has been suggested, which is characterized by proneness to depression. Then we have trait approaches. So, what were trait approaches? So, trait approaches were considered to be the building blocks of person, like the characteristics were to be the, like, as if they are the building blocks of the human. Building blocks of personality. So, human beings display a wide range of variation in psychological attributes. So we'll start with from here. To summarize, traits are relatively subtle over time. They are generally consistent across situations, and their strengths and combinations vary across individuals, leading to individual differences in personality. So, first trait theory was Allport's trait theory. So, this was given by Jordan Allport. Is considered to be the pioneer of trait approach. Let's see what was what was mentioned in this theory. So he characterized traits into cardinal, central, and secondary. So cardinal traits are highly generalized dispositions, like how, like they indicate the goal around the person, like, ki Mahatma Gandhi's non-violence, so that is your cardinal trait. And like Hitler's Nazism, so that is your cardinal traits, where you are like the whole non, like, if we I'll say non-violence, so the first word will come in your mind will be Mahatma Gandhi supported non-violence. Then if I'll say Nazism, then the first will be Hitler. So, like, how you relate such things to each other. Then the another one was central traits. Like, if I say Z is a very warm and sincere personality, and he has done a lot of hard work, and he cherish each moment. So that is your central traits, which we write in your recommendation letters. Then we have secondary traits. Like if I'll say Z love to have lot of food. Z is a very foodie personality. He loves to have mangoes and he loves to have tea all the time. So that is your secondary traits, which says what you like what you prefer in day-to-day basis. So that is your secondary trait. Then next we have is how cattle how cattle gave the theory of personality, I would say, which so like how Raymond Cattle um elaborated about the personality type. So he applied statistical technique called factor analysis to discover the common structure. So he found 16 primary or source traits. So there were source traits which are stable and are considered as the building blocks of personality. Besides these, there are surface traits that result out of interaction of source trait. Then Cattell described the source trait in terms of opposing tendencies. He developed a test called 16 personality factor questionnaire, 16 PF. This is the most important test which you'll be conducting if you choose psychology profession whole of your life. Then 16 personality, also known as 16 PF questionnaire. So next is Eisenach's personality theory. So this was given by H.J. Eisenach. He proposed that personality could be reduced into two broad dimensions, either biologically and genetically based. So first he talked about these dimensions was biologically and genetically based. Each dimension subsumes a number of specific traits. So first he talked was about the neuroticism versus emotional stability. So it refers to the degree to which people have have control over their feelings at one extreme of the dimension, like neuroticism or emotional stability. Sorry, right? Then another dimension was extraversion versus introversion. So it refers to the degree of which people are socially outgoing or socially withdrawn. In the later work, Eisner proposed a third dimension called psychotism and social versus social sociability, which considered to be a fact, which considered to interact with other two dimensions mentioned above. A person who scores high on psychotism dimensions tend to have Eisner. I just hold on. I think I've missed one portion of it. No, yeah. So a person who scores high on psychotism dimension tends to be hostile, egocentric, and antisocial. So Eisner personality questionnaire is a test which is used for studying these dimensions. Then read this five factor five factor model of personality, which is also known as ocean, because it's like openness to experience. Then so C is consciousness, then E is extraversion, then A is agreeableness, and N is neuroticism. This is also known as ocean model of personality and also known as big five factor personality model. It was given by Paul Costa and Robert McCurry. Then we have another approach towards personality, which is psychodynamic approach to personality. So this was there. So this approach holds a very large contribution of Sigmund Freud. In this, he was a physician and he developed this theory in the course of his clinical practice. In the early career, he used hypnosis, and so on. So, this is the most important. This stays with you like whole of your life. So, Freud basically talked about a lot of things. So, what he like said initially was consider so consequences of emotional conflict and the way people deal with the things is the core of everything he focused on. In doing so, it visualizes the human mind in terms of three level of consciousness. So he has given a concept of three level of consciousness. First is your consciousness, then your pre-consciousness, and your unconsciousness. So, what is consciousness? So, this includes the thought and feeling actions which you are aware of. Like, what are you reading right now? So you're reading class 12th chapter 2nd of a psychology book. This is your consciousness. Now pre-consciousness is which includes mental activity of people may become aware only if they attended to it closely. So what were your grades? What was your result of class 11th? That is your pre consciousness. If you'll try to recall, you'll remember it. This was this particular percentage you scored in class 11th. That is your pre consciousness, which can be recalled if you try on to. Then the third level is your unconsciousness, which includes mental activities that people are unaware of. Like if I'll say what when you were 1 year old, did you experience any kind of trauma, or did you had conflict with your parents when you were 1 year old? So this is something which is in your unconscious mind and which is very tough for you to recall, and even if you put a lot of emphasis on it, you might not be able to recall it. So that is your unconscious mind. So he explained it like this: conscious, this is your unconscious, which can be recalled, and sorry, pre-conscious, which can be recalled, and your unconscious, which is like down deep into the surface. Then, according to Freud, unconscious is a reservoir of instinctive and animal drive. So, Freud developed a therapeutic procedure called psychoanalysis. So, the basic goal of psychoanalytic therapy is to bring the repressed conscious material to unconscious material to consciousness, thereby helping people to live in more self-aware, integrated manner. Now he has given a structure of personality. Before that, I would like you to, I'll give you 1 minute. You can go through the levels of consciousness, just read through it so that you like, make sure you understand this portion very clearly and there are no doubts in this particular portion. So now he talks about the structure of personality. So according to Freud, the primary structure elements of personality are id, ego, and superego. So they reside in unconscious as forces, and they can be inferred if from the ways people behave. So let's see what all these things were meant. So id is basically the source of person's instinctual energy. So it deals with immediate gratification of primary needs. This can be your sexual desires, your aggressive impulses. So it works on the pleasure principle. Remember, id, just relate id with pleasure. I'll erase all this material so that it becomes more clear. So, id works on pleasure principle. Remember, where you want immediate things, you're not focusing on another thing, you just want to have them. So this, it does not care what your moral values are, what will society say, what will others say, is what other individuals will think about you. For it doesn't matter. For it's like it deals on pleasure principle, and if you want something, you want it right now. So for it becomes that much of a necessity. Now talking about ego. So ego outgrows of id. So it seeks to satisfy individuals instinctual need, and it works on the reality principle. Just remember that it works on reality principle. I cannot mark it down, so I'm writing it here. Reality principle. It works on reality principle. It's here. And often directs the works on reality principle, often directs towards more appropriate ways of behaving. For example, the id of a boy who wants an ice cream cone tells him to grab the cone, but the ego tells him if he grabs the cone without asking, he may get punished. So that is your ego, which is your reality principle. You know, your mind is aware about the pros and cons of immediately acting on particular incident. So that is your reality principle. Now, the third one is your super ego. So, super ego works on your moral principle. So, it's not, I think so, it's mentioned here. You're morally correct. So, the best way to characterize the superego is to think of the moral branch of the mental functioning. The superego tells id and ego whether gratification in a particular instance is ethical or not. So, that is your superego when it's working only for the moral principle. Right. Freud also assumed that it is energized by two instinctual forces called life instinct and death instinct. He paid less attention to death instinct and focused more on life or sexual instinct. The instinctual life forces that energizes the id is libido. It works on the pleasure principle and seeks immediate gratification. So, all of the studies of this whole thing was done by like whether were done on the basis of either the life instinct or the death instinct, or you can life instinct work on the immediate pleasure, having immediate gratification, and the energy which was like he termed it the force was libido. So remember this is very important. There can be a two-marker question talking about uh, what is libido and what was the energy uh, dealing thing and so on. Then there are so Freud also talked about the defense mechanism. So ego defense mechanism. So according to Freud, much of humans behavior reflects an attempt to deal with or to escape from anxiety. So how the ego deals with anxiety largely determines how people behave. Freud believed that people avoid anxiety mainly by developing defense mechanism that try to defend the ego against the awareness of instinctual need. Thus, defense mechanism is a way of reducing your anxiety by distorting your reality. So he talked about, I guess here they have mentioned five defense mechanisms. We'll go through and we'll see how many are being mentioned. So see, Freud has described many different kinds of defense mechanism. The most important is repression, in which anxiety provoking behavior or thoughts are totally dismissed by the unconscious mind. Like when people repress a feeling or desire, they become totally unaware of that wish or desire. That is that is repression, where you are unaware of your when you have repressed it so much that you are unaware of that feeling or your desire. That is repression, which is being which is basically your defense mechanism you're dealing with. Then the other major defense mechanism is projection, denial, reaction formation, and rationalization. So what happens in projection? People attribute their own traits to other. Like, I did not do it. The person I did not do it. Z did that particular thing. That it's projecting. You're projecting your mistakes onto someone else. So, thus, a person who has strong aggressive tendencies may see other people as acting in an excessively aggressive way towards him or her. So, that the projection is like, I am not angry, you are getting angry. Whereas the person himself is getting way too angry. So that is projection. Then we have denial. A person totally refuses to accept reality. That is denial. Like if somebody is suffering from AIDS, so they may altogether deny their illness. Ki okay, I am like they're in denial. Okay, I'm not suffering from AIDS, and that cannot happen. So denying your reality is denial. Then the other one is reaction formation. So a person defends against anxiety by adopting behavior opposite to his or her true feeling. So that is reaction formation. A person with strong sexual urges who channels his or her energy into religious fervors represent a classical example of reaction formation. So, reaction formation is basically I have a particular kind of energy, I have a particular kind of feeling, but I am like you have seen a lot of scandals coming out recently that people are being so religious and they call themselves priest, but still they are being charged of harassment. So, that is reaction formation. You can say that is reaction formation, but not exactly reaction formation. Now, now we have rationalization. A person tries to make unreasonable feeling or behavior seem reasonable and acceptable. For example, when a student buys a set of new pens after doing poorly in examination, he may try to rationalize his or her behavior by asserting, I will do much better with these pens. So that is your uh, rationalization, where you are like, okay, I did not score good in my examination because my pen was not working. Now I have new set of pen, I'll do way more better with these pen, not the earlier ones. Then, so remember, in this whole topic, what is defense mechanism? What is defense mechanism? Then how many are there, and definite what, like, explain each of them. Remember all these questions properly. Then another one. Now I guess we have stages of personality development. So Freud proposed a five-stage theory of personality, also called psychosexual stages of development. So problem encountered at any stage may arrest development and have long-term effect on a person's life. So he says that there are five stages of development. He talked about psychosexual stages of development, where if one person gets fixated, if one person gets stuck on one stage, then he may or she face problems in later of his or her life. So that is what he tried to explain. So first stage was oral stage, which is a newborn instincts are focused on the mouth. So the infant primary pleasure seeking instinct was the mouth. So it is through a mouth that baby obtain food and reduces hunger. The infant achieve oral gratification through feeding, thumb sucking, biting, and babbling. It is during early months that people's basic feeling about the world are established. Thus, for Freud, an adult who considers the world a bitter place probably had difficulty during the oral stage of development. And he also said ki, if breastfeeding is not smoothly being if a person is if a baby newborn baby is not smoothly detached from breastfeeding, he may later indulge into the habit of thumb sucking or in the habit of smoking, because he considers this mouth as the primary as a primary pleasure seeking thing. Then we have another stage, which is anal stage. So it is found that around ages 2 and 3, the children learns to respond to some of the demands of the society. One of the principal demand made by the parents is that the children learns to control the bodily functions of urination and defecation. So most children at this age experience pleasure in moving their bowels. So the anal area of the body becomes the focus of center of pleasurable feelings. So this stage establishes the basis of conflict between ego and between the desire of babyish pleasure and demand of adult controlled behavior. So this is that phase. Then we have phallic phase. So phallic phase focuses on the genitals. At around ages 4 and 5, this is getting developed. Children begin to realize the difference between males and females. So they become aware of sexuality and the sexual relationship between their parents. So during this stage, male child experiences Oedipus complex, which involves like love for the mother, hostility towards father. So this was driven by a Greek king Oedipus, who unknowingly killed his father and then married his mother. Because this term is derived from there, like developing Oedipus complex. But in females, it is Electra complex. For girls, it is said to be Electra complex, where they have like they develop a love for their father. So it was also derived from a Greek Queen Electra, who induced her brother to kill their mother. Follows a slightly different course by attaching her love to the father. A girl tries symbolically marry him and raise the family. So this is basically where you try to imitate your mother and your father with your specific gender role, and you try to fit in those specific roles to your mother for girls, their mother becomes their role model, and for boys, their father becomes their role model. So this is basically that stage, which is known as phallic stage. So the two important things of this stage are Oedipus complex and Electra complex. Then we have latency stage. So this stage lasts for about 7 years until puberty. During this period, child continues to grow physically, but sexually urges are relatively inactive. Much of energy is channeled into social and achievement related activities. So that is your latency stage. Then later to it is your genital stage, which during this stage the person attains maturity in psychosexual development. The sexuality fears and repressed feeling of earlier stages are once again exhibited. So people learn to deal with members of opposite sex in a social and sexually mature way. However, if the journey towards this stage is marked by excessive stress or overindulgence, it may cause fixation. So, these are the 5 stages. Now, what is fixation? Failure of a child to pass successfully through a stage leads to fixation to that stage. In situation, the child development gets arrested at an earlier stage. So that is fixation. Now we have regression. So regression is also it's also a likely outcome in such situation. It takes persons back to an earlier stage. So regression occurs when a person's resolution of problems at any stage of development is less than adequate. So, in this situation, people display behaviors typical of less mature stages of development. That is your regression. Now, we have a lot of post Freudian approaches. So, these theorists are also called neo have been called neo analytic or post Freudian in order to differentiate the work that is done by Freud. So let's see. So we have Carl Jung, aims and aspiration. So Jung worked with Freud in early stages of his career. So Jung saw human being guided as much by aims and aspirations as by sex and aggression. So Freud's focus was completely on sexual and aggression principle, like life and death principle. But with Jung, his focus was not completely driven by sexual and aggression. He says the human beings work according to their aims and their aspirations. So he developed his own theory of personality, which is called analytical psychology. So, the basic assumption of this theory is that personality consists of competing forces and structures within the individual that must be balanced rather than between individual and demands of society or between the individual and the reality. So, his theory was analytical psychology. The basic assumption of this theory was personality consists of competing forces, structures within the individuals. Remember this, rather than balancing it outside. Then Jung claimed that there are a collective unconscious consisting of archetypes or primordial images. So these are not individually acquired but are inherited. The god or the mother earth is a good example of these archetypes. These are found in myths and dreams and arts of all mankind. So these are your archetypes. So according to him, for achieving unity and wholeness, a person must become increasingly aware of the wisdom available in one's personal and collective consciousness and must learn to live in harmony with it. So that is what he emphasized on. Then we have Karen Horney, uh, who emphasized on optimism. Just a minute. Yeah, who emphasized. So Horney was another discipline. Horney. Horney was another disciple of Freud, who developed a theory that deviated from basic Freudian principles. She adopted a more optimistic view of human life with emphasis on human growth and self-actualization. So what she drive, like the major contribution lies in the challenge to Freud's treatment of women are inferior. Like women, Freud do gave this thing that women are inferior. According to her, each sex has attribute to be admired by other, and neither sex can be viewed as superior or inferior. She countered that women are more likely to be affected by social and cultural factors than the biological factors. She argued that psychological disorders were caused by disturbed interpersonal relationship during childhood when parents' behavior towards child is indifferent, discouraging and erratic. The child feels insecure and feeling is called basic anxiety. So according to her, she emphasized more irrespective of your sex, your behavior is basically formed how you are being treated in your childhood, and how much you were encouraged or how much you were discouraged in your childhood, and these things are the results of your basic anxiety. So deep resentment towards parents or basic hostility occurs due to anxiety. Then comes Alfred Adler, who gave lifestyle and social interest. So, Adler's theory is known as individual psychology. So, his basic assumption is that human behavior is purposeful and goal directed. Each one of us has capacity to choose and create. Our personal goals are the source of our motivation, the goals that provide us with security and help us in overcoming the feelings of inadequacy, are important in our personality development. So in Adler's view, every individual suffers from the feeling of inadequacy and guilt, that is inferiority complex or superiority complex, which arises from childhood. Overcoming this complex is essential for optimal personality development. So, in contrast to Freud's biological orientation, Forman developed. So this was the Adler thing who talked about the inferiority one, and now we have Eric Fromm, who talks about the human concern. So, in contrast to the Freud biological orientation, from I don't know the correct pronunciation of this word, so you guys please check the pronunciation once. Fromm developed his theory from a social orientation. He viewed human beings as basically social beings who could be understood in terms of their relationship with others. He argued that psychological qualities such as growth and realization of potential resulted from a desire of freedom, starving for justice and truth. So, from Fromm holds that character traits, personality basically, develop from our experiences with other individuals, while culture is shaped by mode of existence of a given society. Now we have Erik Erikson's search for identity. So Erik Erikson's theory lays stress on rational conscious ego process and personality development. In his theory, development is viewed as a lifelong process, and identity is granted a central place in this process. His concept of identity crisis of adolescent age has drawn considerable attention. Erikson argues that young people must generate for themselves a central perspective and direction that can give them a meaningful process of unity and purpose. Psychodynamic theory faced a strong criticism from many quarters. So, this is the criticism of this theory. The theory are largely based on the case studies, they lack the rigorous scientific basis. You can read the criticism. Now we have behavioral approach. So, according to them, personality can be best understood at the response of an individual to the environment. Basically, how you are responding and how you're behaving. So, most of the behaviorist, the structural unit of personality is response. Each response is a behavior which is emitted to satisfy the specific need. According to the behavioral approach, children may initially learn to eat such vegetables in anticipation of appreciation, which is reinforcement from their parents. Later on, they may eventually learn to eat vegetables not only because their parents are pleased with this behavior, but also because they acquire the taste of those vegetables and find them good. Thus, the core tendency that organized behavior is the reduction of biological or social needs that energizes behavior. We have read a lot about behavior in class 11th book, also about the theories of classical conditioning given by Pavlov, instrumental conditioning given by BF Skinner, and observational learning, which was given by Bandura, the Bobo doll we were talking about earlier, are well known to you guys already. Then we will jump, just read this topic once. We'll jump to cultural approaches, how the climatic condition, the nature and the terrain of the habitat, and the availability of food in it determines not only one's people's economic activities but also their settlement patterns, social structures, division of labor, and other features such as child rearing practices. So that is your cultural approach towards formation of personality. Then your rituals and your ceremonies, and there are a lot of things involved. Just read this topic. Read. And if you have any questions, you can put it down in the comment section, and we'll answer. We'll make sure that we answer all your questions very precisely. So do let us know about your questions. Now we have humanistic approach. This again is a very important topic. This comes in. This has come in every examination till now. So try to focus on it. So, humanistic theories are mainly developed in response to Freud's theory. So, Carl Rogers and Abraham Maslow have particularly contributed have to the development of humanistic perspective of personality formation. So we'll be talking about these things. So according as proposed by Rogers, Roger is the most important idea proposed by Roger is that fully functioning person, he believe okay so he says an individual is a fully functioning person. He believes that fulfillment and motivating force of a person's personality development, people try to express their capabilities and wait. So, what happens in humanistic approach? So, according to Rogers, he says that an individual is a fully functioning person. He believes that fulfillment is the motivating force of personality development. People try to express their capabilities, potential, and talents to the fullest extent possible. This is an inborn tendency among people that directs them to actualize their inherited nature. He says that an individual is a fully functioning being. He will thrives out and show his fullest extent possibilities to achieve anything or to form his own personality. So Rogers make two basic assumptions about human behavior. One is that behavior is goal directed and worthwhile. The second one is that people who are innately good will almost always choose adaptive and self actualizing behavior. So Rogers has given two basic assumption. One is this thing, the behavior is goal directed, and the second one is that people who are innately good will almost always choose adaptive self actualizing behavior. So Rogers theory grew out of his experience of listening to patients in his clinic. So he noted that self was an important element in the experience of his clients. Thus, his theory is structured around the concept of self. The theory assumes that people are constantly engaged in process of actualizing their true self. So that was he basically emphasized on the building up of the self and how to deal with self and so on. So this is a so it's like this is your self concept and your experiences and how well adjusted, how properly mixed and well adjusted individual you are, and this is like how poorly adjusted like individual. Hold on. how well adjusted and how poorly adjusted you happen to be. So if you will read, like here it says, discrepancy between the real self and ideal self often results in unhappiness, dissatisfaction. Rogers' basic principle is that people have a tendency to maximize self concept through self actualization. In this process, the self grows, expands, and become more social. You can see here. So Rogers view personality development as continuous process. It involves learning to evaluate oneself and mastering the process of self-actualization. So the situation warrants that an atmosphere of unconditional positive regard must be created in order to ensure enhancement of person's self-concept. The client-centered therapy that Rogers developed basically attempts to create this condition. Now, now we'll be reading about the Maslow and the hierarchy of needs he proposed. Maslow has given a detailed account of psychologically healthy people in terms of their attainment of self actualization, which was the last thing in their hierarchy of needs. A state in which people have reached their own fullest potential. Maslow had an optimistic and positive view of man who has potentialities for love, joy, and to do creative work. Human beings are considered free to shape their lives and to self actualize. Self actualization becomes possible by analyzing the motivation that govern our life. We know that biological security and belongingness needs, called survival needs, are commonly found among animals and human beings. Thus, an individual's sole concern with the satisfaction of these needs reduces him or her to the level of animals. The real journey of human, I think you can read from here. Then we have assessment of personality. How you can how you can actually assess personality. A formal effort aimed at understanding personality and personality sorry a formal effort aimed at understanding personality of an individual is termed as personality assessment. Assessment refers to the procedure used to evaluate or differentiate people on basis of certain characteristics. The goal of assessment is to understand and predict behavior with minimum error and maximum accuracy. So that is basically assessment. So, psychologists have tried to assess personality in various ways. The most commonly used techniques are psychometric test, self report measures, projective techniques, and behavioral analysis. So, uh, we have read about the self report in previous chapter also. So, self report measures, it was Allport who suggested that the best method to assess person is by asking him or her about himself or herself. So that is self report, where you are asking a person to describe about himself or herself. Then we have the Minostar Multiphasic Personality Inventory, which is also known as MMPI. This inventory is widely used as a test in personality assessment. Hathaway and McKinley developed this test as a helping tool for psychiatric diagnosis. So just read what items does this test conduct and all those things. Then we have Eisensick questionnaires, personality questionnaire, which is also known as EPQ. So this focused on, like, this has two dimensions of personality called introverted and extroverted, and emotionally stable and emotionally unstable. So later, Eisenach added third dimension called psychotism, as we have read about this in the theory of personality also. Then we have 16 PF read. We have discussed about this earlier also, about what the test says. Then we have projective techniques. So what is projective techniques? This happens to be the again important part, and there are questions talking about describe what do you understand by projective techniques, and what are the tests uh, which comes under this category. So, the techniques of personality assessment so far are known as direct techniques, the ones which we have read before this. Now we have projective techniques. These are the way of assessing. Basically, projective techniques are indirect way of assessing your personality. So they talk about a lot of things all together while assessing your personality. People generally become self conscious and hesitate to share their private feelings, thoughts, and motivations. But when they do so, they often do it in a socially desirable manner. The psychoanalytic theory tells us a large part of human behavior is governed by unconscious motives. The direct method of personality assessment cannot cover the unconscious part. Hence, they fail to provide with a real picture of an individual's personality. So, now what is projective techniques? So, projective techniques were developed to assess unconscious motives and feelings. These techniques are based on the assumptions that have less structured or unstructured stimulus or situation. So these are projective techniques. A variety of projective techniques have been developed. They use various kind of stimulus material and situations for assessing personality. Let's see. So read about projective techniques. You'll get through. So first is the Rorschach ink block test. So this was developed by Hermann Rorschach. The test consists of 10 ink blots. 5 of them are black and white and 2 with red ink, and the remaining 3 in some pastel colors. So this ink block are symmetrical in design, and they form a specific design with a specific shape or form. Each blot is printed in the center of the white cardboard. You can see in this particular picture. The blots are originally made by dropping ink and then folding the paper, and whatever the image comes out, that is your ink blot. So the cards administered individually are in two phases. In the first phase is performance proper. The subject are shown the card and asked to tell us what they see in the picture, in each picture which they are being shown. And in the second phase is called inquiry. A detailed report of the response is being done, is prepared by asking the subject to tell where, how, and what, and on what basis a particular response is made them. Like if I have shown you this particular card, so I'll ask you, okay, so what do you see here? So if you'll say, okay, I see a bat here, a bat is hanging in upside down, then I'll ask you, okay, then which part are you looking at, which is making you see this particular thing? So you say, okay, I'm just looking at this particular thing, and which is like upside down, and I see okay, the bat is hanging upside down. So that is how the two phases are being derived differently. Then we have TAT, which is Thematic Appreciation Test. So this was developed by Morgan and Murray. It is a little more structured than inkblot test. The test consists of 30 black and white pictures called a blank card. Each picture card depicts one or more people in a variety of situation, and then the person is asked to frame a story, and like the card is shown and you're asked to frame a story, or you have to write a narrative about that particular picture, whatever you are grasping or whatever you are seeing from that picture. So TAT is that. Then next one is, okay, this one is the illustration showing TD card. Now this picture is shown to you and you have to write down something about it. People usually write stories, and there's a hero in a story and there's a victim in a story, and that's how you try to drive information from what that particular person is trying to say, and you assess those things, all those stuff. Then we have Rosenwick picture frustration study, which is PF study. So this test was developed by Rosenwick to assess how people express aggression in the face of frustrating situation. So the test presents, with the help of cartoon like picture, a series of situation in which one person frustrates another or calls attention to a frustrating condition. So the subject is asked to tell what the other frustrated person will say or do. And then you have to respond to it. Then the analysis of the response is done on the basis of the direction of aggression. So an attempt to made to examine whether the focus is on the frustrating object or on the protection of the frustration of a person is like done. Then we have sentence completion test. So this is basically like I've so my father dash. So you have to complete the sentence. My greatest fear dash. So these type of statements are being given, and the person is asked to reflect their attitude, their motivation, or their conflicts on the basis of the statement provided. So we analyze it by on the basis of motivation, attitude, and conflicts. And people, like, the subject is randomly writing how whatever way he or she wants to complete that particular sentence. Then we have draw a person test. So it is a simple test which subject is asked to draw a person on a sheet. A pencil and eraser is provided to facilitate the drawing. After the completion of the drawing, the subject is generally asked to draw the figure of an opposite sex of the person. Finally, the subject is asked to make a story about the person as if he or she was a character in a novel or play. Some examples and of interpretations are omission of facial features. Lot many times this type of figure is being observed, such as that person tries to evade a highly conflict-ridden interpersonal relationship. Then graphic emphasis on the neck suggests that lack of control over impulses is being there. Then we have disproportionately large head, suggest organic brain disease and preoccupation with headaches and so on. Now we have behavioral analysis. So a person's behavior in a variety of situations can provide meaningful information about his or her personality. So an observer's report may contain data obtained from interview, observation, ratings, nomination, situation tests. It depends. So, what are interviews? We have discussed that interview is basically done on the basis of one-to-one base. Like, either there are group interviews or there are one-to-one interviews, and it depends how they are being administered. Now we have structured interview or unstructured interview. So structured interview is where your structured interview is uh, where the set of questions are already being structured, and where the mode of uh, just hold on for a minute. Yeah, structured interview. The interview seeks to develop an impression about a person by asking uh, yeah, by asking number of questions, the way the person presents himself and answer the questions which like structured are, which is already being unstructured are, which are like answer leads to the formation of another question. And whereas structured interviews addresses a very specific questions and follow set of procedure. So this often is done to make objective comparison of persons being interviewed. So use of the rating scales may further enhance the objectivity of the evaluation. Now we have observational. Now we have observation. So behavioral observation is another method which is very common used for assessment of personality. Although all of us watch people form impressions about personality. So what happens in observation is, so basically, uh, like we have discussed earlier, like observing a football match, like I want to see the stress level of people while before a football match. So that is my observational setting, but here we'll be talking in a different manner. So, observation requires careful training of the observer and a fairly detailed guideline about analysis of behavior in order to assess the personality of the given person. For example, a clinical psychologist may like to observe his or her client interaction with family member and home visitors. So, those are the things. Then you can read again. Then we have behavioral ratings. So we will start. Okay. The method of rating suffers from the following major limitations. So we'll be directly jumping to the limitations of uh, behavioral ratings. So behavioral ratings are frequently used for assessment of personality in an educational and industrial setting. What are the limitations? So rates are often display certain biases that color their judgments for of different traits. For example, most of us are greatly influenced by a single favorable and unfavorable trait. This often forms the basis of a rater's overall judgment of a person. This tendency is called halo effect. Again, halo effect is a very important term which comes in examination. Like there are questions, there are 1 marker or 2 marker questions asking what do you understand by halo effect. So raters have a tendency to place individuals either in the middle of the scale, which is like middle category biasness, by avoiding extreme positions, or in the extreme positions called, or the extreme positions, so which are called extreme response biasness, which is like providing avoiding the middle category of the scale. So basically either you'll be the what in this rating thing, what are the biasnesses? Either the rater wants you to be in a middle category, so that you're neither on the top of the list, neither you're in the bottom of the list, or there are extreme response biasness where either the either it is extremely on the top of the list or in the bottom of the list. So these tendencies can be overcome by providing raters with appropriate training, or by developing such scales which response biases is likely to be small. Then another method for assessment is nomination. So this method is often used in obtaining your peer assessment. It can be used with persons who have been in long term interaction and who know each other very well. In using nomination, each person is asked to choose one or more person of a group with whom he or she would like to work. So study, play, or participate in, like lot of many times when you're playing particular sport, you're being asked, like there are two team captains, and captains are choosing like what all players they want in their team. So that is a nomination method. So, nomination thus received may be analyzed to understand the personality and behavioral qualities of the person. So, this technique has been found to be highly dependable, though it may also be affected by your personal biasness. Like, you might not like a person, you might not like to take a particular person, but still you have to take that person. So there are a lot of biasness. Or you choose your friends first and you happen to choose the people who are not your friends, who are not who you are not in good terms with in a later of your nomination. Then we have situational test. So, a variety of situational tests have been devised for assessment of your personality. So, the most commonly used situational test of this kind is a situational stress test. It provides us with information about how a person behave under stressful situation. The test requires person to perform a given task with other person or who are instructed to be non-cooperative and interfering. The test involves a kind of role playing. Test requires a kind of a role playing. So this person is instructed to play a role for which he or she is being observed. A verbal report is also obtained on what and how she was asked to do, and the situation may be realistic one or it may be created through a video play. So that is your situational test. So we have covered a lot in this chapter, and there have been this chapter holds up to be a very important chapter for your examination. We have discussed about a lot of things like what is self-esteem, what is self-efficacy, what is self-regulation, what is self. First of all, so there are a lot of important questions like what is self and further things. What is self and how to go about it and so on. Then what did Sigmund Freud talk about personality? Then theories of personality are very important in this chapter. So if you liked this whole video, then do share it with your friends, and if you have any question you can put it down in the comment section. Do subscribe to our channel and do give a big thumbs up if you like this video. Thank you so much.